Right now, our school districts across the state are working closely with local public health districts to finalize their plans for a safe reopening of schools. 1 month ago, we stood here, well actually over there, to roll out Idaho's official framework to guide local school officials as they assemble their plans. We also stood here to reinforce the expectation that students must return to school for in-person instruction as much as possible. School operations will not look the same across the state based on virus activity and healthcare capacity in specific communities. However, when students are out of the classroom for too long, the achievement gap widens. This gap draws down the progress of all students. This gap is detrimental to economic prosperity and future workforce demands. This gap inhibits an educated populace, which is critical to a successful democratic republic. Despite the incredible advances in digital learning, we can't even run this thing, you can never replace the value and impact of in-person interaction with professional, dedicated teachers. The expectation is that schools will not be closed for extended periods of time during the 2021 academic year. I genuinely understand the deep concern of some teachers and parents about returning to school for in-person instruction. That is why we have put significant resources into the safe reopening of schools. We've put $10 million towards additional masks, gloves, sanitizers, and plexiglass for Idaho schools. $48 million will help bridge the digital divide. Blended learning will be a reality for many Idaho students. And we're equipping schools with computers, connectivity, and other resources to ensure successful remote learning. We put $21 million towards COVID-19 testing for teachers and staff. Our testing task force identified these critical workers as a priority group, and the task force is nearing completion on its recommendation for testing staff and students. The $3 million we put toward increasing testing lab turnaround time and capacity, as well as lab upgrades, will help us to get test results for teachers and school staff as quickly as possible. An additional $3 million will leverage Idaho's pharmacies in testing efforts to help us quickly produce testing results for teachers and school staff and families in rural Idaho, where the majority of Idaho school districts are located. All these steps are helping to make schools safe places to teach and learn. The unprecedented amount of money we are pumping into our schools for safety should provide teachers and parents with the confidence to return to the classroom for in-person instruction. At the state level, we remain engaged with local school leaders across the state, and we're watching closely why those school districts and charter schools develop and refine their reopening plans. Meanwhile, bolstering public schools financially continues to be our focus. While Idaho state government, all of Idaho state government is facing 5% cuts this year, far better than the 20 to 40% reductions that are taking place in other states, Idaho public schools will be minimally impacted by revenue shortfalls. Fiscal conservatism elsewhere in state government, combined with the relief funds we directed to K-12, means teachers, students, and parents won't feel as much an impact in schools here as they will in other states. We are in a much different place now than we were in March. Our economy is open. Our parents have returned to their places of work. We have increased our capacity for testing, contact tracing, PPE, and other healthcare capacity to make it more adequate. Of course, In the more populated areas of Idaho, Ada, Canyon, Kootenai, Bonneville, and Twin Falls counties, in particular, virus activity is straining our local healthcare system. On the other hand, we have half our counties with a current case rate of less than 11 cases per 100,000 residents. Our shift to a more localized response to COVID-19 is the right approach. Where the public health district boards have done the right thing to address outbreaks by implementing appropriate mitigation measures, we are seeing positive results. Today, I'm announcing that statewide, Idaho will remain in stage 4 for another 2 weeks. Over the last month, you have heard us talk about adding new information to our metrics review process to better capture the impacts on our healthcare system in Idaho. In addition to all the other statewide metrics we've been examining every 2 weeks, we will now also review overall hospital admissions. This is information we didn't have access to previously, and the White House suggested we use it in our decision-making progress. Even though we will remain in stage 4 statewide for another 2 weeks, our statewide metrics are looking better. We have sufficient healthcare workers, PPE, ventilators, and ICU beds. We are meeting the demands for testing our healthcare workers. We are seeing downward trend in overall case counts as well as our percent positivity rates. Emergency room visits for those with COVID-like symptoms are on the decline. To my reporter friends, I ask that you cover these points. What I frequently read on your posts is just the daily case counts, especially in the areas of the most spread. Clearly, our decision-making is based on more than just daily case numbers. We do need to bring down the number of hospital admissions statewide, but even in some of the hot spots, we are starting to see the benefit of measures that local health officials and mayors have implemented to reduce the rate of spread and preserve hospital capacity. That tells me our efforts are working. Thank you, Idahoans, for wearing a mask in public, keeping physical distances from others, maintaining good hygiene and clean spaces, and for staying home if you're sick. If we continue to practice these measures, we will be able to send our kids back to school. We will be able to keep our citizens safe and continue to rebound our economy and restore jobs.